So dear students, the last topic which we will be discussing in intestine is the malabsorption syndromes. So what is the definition? It is defective absorption of fats, carbohydrates, proteins, water, electrolytes, minerals and vitamins. So there will be defective absorption of all this: fats, carbohydrates, proteins, water, electrolytes, minerals and vitamins. The clinical features include weight loss, anorexia, abdominal discomfort, borborygmi, and muscle wasting. Diagnosis of malabsorption syndromes is by intestinal biopsy. The diagnostic feature is steatorrhea, where there will be abnormal, bulky, frothy, greasy yellow stools. So malabsorption syndrome, what is the definition? There will be defective absorption of all the essential nutrients. The clinical features will be weight loss, anorexia, discomfort and muscle wasting and all the deficiency symptoms. Yes, and diagnosis is by intestinal biopsy. And the diagnostic feature of any malabsorption syndrome is steatorrhea, where there will be abnormal, bulky, frothy and greasy yellow stools. Okay. The pathogenesis of malabsorption can be due to defects in intraluminal absorption, defect in terminal absorption, defect in transepithelial transport, decreased small intestinal surface area, lymphatic obstruction, infection and iatrogenic. So the pathogenesis of malabsorption can be due to any of the following. They can be defect in intraluminal absorption. They can be defect in terminal absorption. They can be defect in transepithelial transport. They can be decreased small intestinal surface area, lymphatic obstruction, infection and iatrogenic causes. Okay, so these all can lead to malabsorption. So this is the normal structure of the intestinal villi, showing the lacteals, blood capillaries, the goblet cells, arteriole, venule, lymphatic vessels. Yes, here the normal absorption will take place in the intestine. So now coming to the first disease, that is celiac disease or celiac sprue or gluten sensitive enteropathy. Definition: it is a mucosal lesion of the small intestine and impaired nutrient absorption. So in celiac disease, it is a mucosal lesion of the small intestine with impaired nutrient absorption. It is common in Caucasians. There is a family history and MHC class 2 association. So the names of celiac disease is celiac sprue, gluten sensitive enteropathy. Okay. The pathogenesis is sensitivity to gluten. T cell mediated chronic inflammatory reaction is seen and autoimmune component is also there. Diagnosis is by endoscopy, where the mucosa is flattened or scalloped, and on serology anti-gliadin, anti-endomysial antibodies will be present. So the pathogenesis is sensitivity to gluten. Diagnosis is by endoscopy, where the mucosa will be flattened and scalloped, and on serology there will be anti-gliadin and anti-endomysial antibodies. Biopsy will show diffuse enteritis, inflammation of the intestine with marked atrophy or total loss of villi. The surface epithelium will show vacuolar degeneration, loss of microvillus brush border, increased number of intraepithelial lymphocytes. The biopsy of these specimens of the intestinal biopsy specimens of celiac disease will show diffuse enteritis, diffuse inflammation with marked atrophy or total loss of villi. Surface epithelium will show vacuolar degeneration, loss of microvillus brush border and increased number of intraepithelial lymphocytes. The crypt will show increased mitotic activity, hyperplastic and tortuous. These crypts will be hyperplastic and tortuous. The changes are more marked in the proximal small intestine. The mucosal changes revert back to normal by exclusion of gluten from diet. So this is because of the gluten which is present in the wheat. Okay. The clinical features will be diarrhea, flatulence, weight loss, fatigue and extraintestinal features of malabsorption will be there. Complications of celiac disease: malignancy can occur, NHL, non-Hodgkin's lymphoma and small intestinal adenocarcinoma and esophageal squamous cell carcinoma. So about celiac disease, we will just revise. It is a type of malabsorption. It is gluten sensitive enteropathy common in Caucasians, mucosal lesion involving the small intestine with impaired nutrient absorption. Pathogenesis is sensitivity to gluten, which is a protein present in wheat. It is due to T cell mediated chronic inflammatory reaction and autoimmune component. Diagnosis by endoscopy and serology. Biopsy will be showing loss or atrophy of the villi with the epithelium showing so many changes like vacuolar degeneration, loss of the microvillus brush border, and increased number of intraepithelial lymphocytes. The crypts also will be hyperplastic and tortuous. These changes, all changes on the mucosa, will revert back to normal by exclusion of gluten from diet. The clinical features and complications. So this is about celiac disease or celiac sprue. The next condition is the tropical sprue or post-infectious sprue. This is celiac-like disease. It is common in tropics. That is why it is called tropical sprue. Etiology is due to enterotoxigenic E. coli and Haemophilus. It can occur all levels of small intestine. Celiac disease common in the proximal intestine. Here all levels of small intestine can be involved. So this E. coli and Haemophilus infection will be there. There will be deficiency of B12 and folate and leading to megaloblastic change similar to pernicious anemia. Treatment will be antibiotics, usually broad spectrum antibiotics. Okay. So celiac like disease it is also known as post-infectious sprue. Tropical sprue common in the tropical region and post-infectious following infection with E. coli and Haemophilus, and all levels of the intestine will be involved, and B12 and folate deficiency absorption will be impaired leading to megaloblastic anemia. The treatment is by antibiotics, broad spectrum antibiotics. Next is Whipple's disease or intestinal lipodystrophy. Here the etiology is due to Trophorema whippleri bacterium, which is a gram-positive actinomyces. It proliferates preferentially within the macrophages and invokes no significant host immune reaction. So this organism, it is a gram-positive actinomyces, which is Trophorema whippleri. This will proliferate within the macrophages. That is why it will not invoke any host immune reaction, because it is within the cell macrophage. And it can involve any organ of the body like the intestine, the CNS, joints. Diagnosis is by PAS positive macrophages. These macrophages contain rod-shaped organisms which can be identified by the PAS staining as well as electron microscopy. So Whipple's disease is intestinal lipodystrophy caused by Trophorema whippleri, which is an actinomyces, and it proliferates preferentially within the macrophages, which can be detected by PAS staining and electron microscopy. Not only the intestine but brain, the CNS and joints also can be involved. Microscopically, the important feature is small intestinal mucosa, which will be laden with distended macrophages in the lamina propria. The mucosa will be showing lot of macrophages filled with this organism, that is Trophorema whippleri. The expansion of the villi by the dense inflammatory infiltrate of the macrophages, it will impart a shaggy appearance to the mucosa. Because of this, Trophorema whippleri within the macrophages which are present in the mucosa, there will be shaggy appearance to the mucosa, and the edema of the mucosa will cause thickening of the intestinal wall. There can be involvement of the mesenteric lymph node and lymphatic dilatation also. These bacilli-laden macrophages can also be found not only within the intestine but also in the synovial membranes of the joints, in the brain, cardiac valves. So other areas, important areas like the brain and the heart also can be involved, and joints also can be involved, not only the intestine. Inflammation is absent but functional impairment is present. Because of the presence of the bacilli-laden macrophages in the mucosa, the function of the mucosa is impaired. Similarly, these bacilli-laden macrophages, if they are present in the synovium, the function of the synovium will be impaired. Whether if they are present in the cardiac valve, the cardiac valve function will be impaired. Though it is not causing direct inflammation, but because of the physical presence, it is causing functional impairment. Hope it is clear to all of you, ma? Yes? So microscopically, this most important feature is the mucosa laden with macrophages filled with the bacilli, and this will impart a shaggy appearance, causing thickening of the mucosa, and the function of the mucosa will be impaired. And wherever these bacilli laden macrophages are present, they will impair the function, whether it is the heart valves, whether it is the brain, whether it is the joints, synovium. Okay. The clinical features will be features of malabsorption if it is present in the intestine. If it is present in the joints, arthropathy. If the lymph nodes are involved, lymphadenopathy. And skin is involved, hyperpigmentation. It is common in the 4th and 5th decade, common in males. So this is about the Whipple's disease or intestinal lipodystrophy caused by Trophorema whippleri. Proliferates within the macrophages, involves the intestine, CNS, joints, heart. Yes, PS positive macrophages, rod-shaped organisms on electron microscopy. They will not cause inflammation, but it will cause functional impairment. And the features will be depending upon the site involved. The next is the disaccharidase lactase deficiency. This enzyme is located in the apical cell membrane of the villous epithelial cells. It will cause the breakdown of lactose. So because of this enzyme deficiency, there will be incomplete breakdown of disaccharide lactose, and that will lead to osmotic diarrhea. So this lactase deficiency can be genetic, seen in infants on milk feeding, or acquired, seen in adults due to bacterial or viral infections. So lactose intolerance, hope you all have heard about it. Yes, that will be because of this enzyme disaccharidase lactase deficiency. So there will be incomplete breakdown of the lactose, disaccharide lactose. That will lead to osmotic diarrhea. It can be seen in infants, that is genetic, and it can be acquired due to bacterial or viral infection. Okay. Then A beta lipoproteinemia. This is an inborn error of metabolism. It is autosomal recessive. There is inability to synthesize apolipoprotein B. The triglycerides are stored in the intestinal epithelial cells, leading to lipid vacuolation. Absence of plasma lipoprotein. Failure to absorb certain essential fatty acids leads to membrane defects. Acanthocytic erythrocytes. So, A beta lipoproteinemia, it is an inborn error of metabolism, autosomal recessive. There is inability to synthesize apolipoprotein B. So, the triglycerides transport is affected. They get stored in the intestinal epithelial cells, leading to lipid vacuolation, and there will be absence of plasma lipoprotein. So, as an absorption of certain essential fatty acids will occur. That will lead to membrane defects and acanthocytic erythrocytes. Okay. So, their basic defect here is the apolipoprotein B. This is the normal villi. First picture is showing the normal villi of the small intestine. Second one is the flattened villi due to malabsorption. Okay. With this, we end the topic of intestine. Hope all of you are clear with the topics. Yes. If you have any doubts, please ask. Thank you.